Critical to the eventual success of the Stroke Rehab app is its capacity to support the design of a wide range of therapy programs that can be delivered remotely to stroke survivors living in their own homes, while allowing the therapists located in metropolitan or regional hospitals and clinics to monitor the progress of the stroke survivor's recovery and to make appropriate adjustments to those therapy programs. This presentation, consisting of 4 parts, outlines how the Stroke Rehab app will support the definition, design and ongoing customisation of therapy programs. This diagram identifies the main classes of data objects that need to be created and maintained in the central database to enable care plans to be developed for stroke survivors and their component therapy programs to be defined and customised by appropriately qualified medical professionals. These data object classes have been divided into 5 groups, which will be discussed in this and the subsequent parts of this presentation. Firstly, there is a group of administration data object classes that identify the medical professionals and professional organisations that provide medical services to stroke survivors and their carers. This group will be presented in part 1 of this presentation. Secondly, there is a group of care plan data object classes that deal with the creation of a care plan for a stroke survivor and the initial selection of appropriate therapies as components of that care plan, and the assignment of responsibilities for those components to appropriately qualified professionals. This group will also be presented in part 1 of this presentation. Thirdly, there is a group of therapy design data object classes that break each component of the care plan down into a number of component activities. The linkage of those activities together into a logical sequence, and the identification of informational and other kinds of resources that need to be involved in the performance of those activities. This group will be presented in part 2 of this presentation. Fourthly, there is a group of therapy session data object classes that record information about individual therapy sessions performed by stroke survivors. These will be described in part 3 of this presentation. And finally, there is a group of communication data object classes that can be used to establish stroke recovery related forums and special interest groups involving stroke survivors, carers, therapists, specialists and research workers. These will be described in part 4 of this presentation. So, for now, we will concentrate on the first 2 of these data object class groups, the administration group and the care plan group. The first group of data object classes represent information about the organisation and administration of stroke-related therapy programs at the national, state, regional and community levels. Firstly, there are organisation data objects that represent the medical organisations which have a direct or indirect interest in stroke and which operate in Australia, such as hospitals, clinics and professional organisations, and both private and public organisations. Then there are medical professional data objects that represent the appointments of qualified persons to positions within specific medical organisations, such as the various clinical or therapeutic positions within hospitals or clinics. Then we have a set of data object classes that represent the various stroke-related medical disciplines and their approved and hopefully evidence-based therapies. Here we have discipline data objects to represent medical or allied health disciplines which are relevant to the entire scope of the stroke recovery and rehabilitation industry. This includes, for example, physiotherapy, occupational therapy, speech therapy, and so on. Then we have discipline administrator data objects that identify the medical organisations that are responsible for the administration, professional standards and ongoing education of qualified clinicians and therapists. For example, the discipline of physiotherapy is administered in Australia by the Australian Physiotherapy Association. Then we have therapy program data objects that represent the evidence-based therapies that have been approved for use by the organisation that administers the relevant discipline, and for which there are presumably approved educational programs designed to keep qualified professionals up to date in their methods and applications. The second group of data object classes represent information about the care plans that may be developed and managed for stroke survivors. This builds on the existing mechanism that can be used to manage the long-term recovery of stroke survivors with severe or complex disabilities. But it extends that concept to all stroke survivors so that their long-term recovery in the community can be planned and managed efficiently and effectively. So first we have the care plan and care plan component data objects. The care plan data objects represent the care plans similar to the ones that are sometimes created and maintained by a stroke survivor's GP. They represent the long-term plans for the recovery and rehabilitation of a stroke survivor that are prepared and maintained by one or more medical professionals over time. These care plan objects can be defined in the following way. A person may have one care plan, and a care plan must be prepared for one person. And a medical professional may manage many care plans, and a care plan may be managed by many medical professionals. Then we have care plan component data objects, which represent the clinical or therapeutic components of a stroke survivor's care plan. In other words, they're prescribed therapies or clinical interventions. Obviously, these care plan component objects may need to be added to or deleted from the survivor's care plan over time as his or her recovery proceeds. These care plan component objects can be defined in the following way. A care plan may include many therapy programs, and a therapy program may be included in many care plans. Next, we have care plan role and professional role data object classes. The professional role objects represent the roles that a medical professional may be responsible for in relation to a particular component of the stroke survivor's care plan. For example, these roles might include the role of prescribing a therapy or consulting in the use of a therapy. And there are care plan role data objects that represent the actual roles played by a particular medical professional in managing a specific component of a particular stroke survivor's care plan. These care plan role objects can be defined in the following way. A medical professional may play many professional roles in relation to many care plan components, and each care plan role must be played by one medical professional, must relate to one care plan component, and must be classified by one professional role. So we have now identified the main data object classes that are needed in the central database to define and administer the medical aspects of a stroke survivor's recovery journey following their discharge from hospital back into the community setting. It should, of course, be mentioned that there may be a need to re-examine some aspects of this design once details of any future e-health initiative become available. We can summarise the first part of this presentation by pointing out that the central database that supports the Stroke Rehab app can be used to store and distribute administration data that identifies the medical professionals and professional organisations that provide medical services to stroke survivors and their carers, and care plan data that deal with the creation of a care plan for a stroke survivor and the initial selection of appropriate therapies as components of that care plan, and the assignment of responsibilities for those components to appropriately qualified medical professionals. In the next part of this presentation, we will see how individual therapies in a care plan can be broken down into a number of component activities, and how those activities are linked together into a customisable workflow, and how various kinds of resources that need to be involved in the performance of these activities are defined